Hi, welcome to MRCP PACES introductory video. I am Dr. Costa. I passed PACES on my first attempt with a good score. If you are watching this video on YouTube, then you'd find all my details in the description box. PACES stands for Practical Assessment of Clinical Examination Skills. It means it is a practical examination. In this examination, you as a candidate have to demonstrate your clinical skills, communication skills, and clinical knowledge while maintaining a professional attitude. PACES examination at a glance. It is a half-a-day examination. It takes place in a clinical setting, for example, in a hospital or clinical skills center. This examination assesses 7 core skills in 5 stations. I would talk about these 7 skills and 5 stations subsequently. And you would have to encounter 8 patients in these 5 stations. This is the current PACES carousel. I am aware that RCP can introduce the new PACES carousel in near future. I would update this video once they introduce the new carousel. So here you can see all 5 stations of MRCP PACES. Your examination can start from any station. After the start of the examination, you will have to follow the arrows shown in this picture. In my case, my examination started from the station 2. After finishing station 2, I finished station 3, then station 4, next station 5, and at the end station 1 to finish my PACES examination. Let's start our discussion from station 1. Here you will be given 2 cases, 1 respiratory case and 1 abdomen case. You will have 10 minutes to finish each case and there would be no time interval between these 2 cases. It means after completion of respiratory case, you will have to quickly move to abdomen case. For the respiratory case, you will get 6 minutes to complete the full respiratory examination. In the last 4 minutes, you will have to present the important positive and negative findings and a list of differentials. Then the examiners will ask you several questions regarding the case. You will have to successfully defend these questions to pass the case. The same applies to the abdomen station. 6 minutes for abdomen system examination and 4 minutes for presentation and defending the examiner's questions. Station 2. This is the history taking station. Here you can only talk to the patient to take the complete history. Here you cannot touch the patient or examine the patient. In most cases, you will not get a real patient here. A surrogate will give you the history. The total duration of this station is 20 minutes. You will get 14 minutes to take the complete history, address the concerns of the patient, and if necessary discuss the investigation and management plan with the patient. You should not use medical jargon with the patients. After 14 minutes, you will get 1 minute to collect your thoughts. And in the last 5 minutes, you will have to present your case to the examiners in a professional way. You will tell them the list of differential diagnoses according to the history given by the patient. Then the examiners will ask you a few questions and you will have to answer these questions correctly. Station 3. Station 1 and 3 are similar in structure. In station 3, you will get 1 cardiology case and 1 neurology case. The total duration of each case is again 10 minutes, 6 minutes for the full system examination and 4 minutes for presenting the case, mentioning the list of differentials and defending the examiner's questions. Station 4. This station will test your communication skills. You will get 20 minutes of time to complete this station. You will be talking to the patients or surrogate for 14 minutes. The common scenarios for this station are breaking bad news, describing a medical or surgical procedure, medical error, medical negligence, refusal of treatment, genetic counseling, etc. Basically, the station will proceed according to the task you were given. You will also have to manage patients' concerns and summarize the discussion if necessary. After 14 minutes, you will have 1 minute to collect your thoughts. In the next 5 minutes, The examiners may ask you questions related to ethical and legal factors associated with the case. You will have to defend the examiners successfully to pass this station with a good score. Lastly, station 5. Here you will get 2 cases. You will have 10 minutes to complete each of the cases. You will get 8 minutes to take a brief clinical history and do the focused clinical examinations of the patient. In the last 2 minutes, you will have to present the differentials and defend the examiners. This ends the brief description of the stations. Now let's talk about the 7 clinical skills that you would have to master in order to pass MRCP PACES. The 7 clinical skills are physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patients' concerns, and maintaining patient welfare. Please be mindful that all 7 clinical skills will be tested in station 5, which means the brief clinical consultation station. Station 1 and 3, which means respiratory, abdomen, cardiovascular, and nervous system stations, will test 5 clinical skills. These are physical examination, identifying physical signs, differential diagnosis, clinical judgment, and maintaining patient welfare. Station 2 or history taking station will test you for clinical communication skill, differential diagnosis, clinical judgment, managing patient's concern, and maintaining patient welfare. Station 4 will test you for 4 skills. These are clinical communication skill, clinical judgment, managing patient's concerns, and maintaining patient welfare. Now let's talk about what 7 clinical skills actually mean. Physical examination skill. Here you would have to demonstrate correct, thorough, systematic, or focused in station 5 encounters, appropriate, fluent, and professional technique of physical examination. For identifying physical signs skill, you would have to identify physical signs correctly and not find physical signs that are not present. For clinical communication skill, you would have to elicit a clinical history relevant to the patient's complaints in a systematic, thorough, or focused in station 5 encounters, fluent and professional manner. Explain relevant clinical information in an accurate, clear, structured, comprehensive, fluent, and professional manner. For the differential diagnosis skill, create a sensible differential diagnosis for a patient that the candidate has personally clinically assessed. For clinical judgment skill, select or negotiate a sensible and appropriate management plan for a patient, relative, or clinical situation. Select appropriate investigations or treatments for a patient that the candidate has personally clinically assessed. Apply clinical knowledge, including knowledge of law and ethics, to the case. For managing patients' concerns, here you would have to seek, detect, acknowledge, and address patients' or relatives' concerns, listen to a patient or relative, confirm their understanding of the matter under discussion, and demonstrate empathy. For the maintaining patient welfare skill, here you'd have to treat a patient or relative respectfully and sensitively and in a manner that ensures their comfort, safety, and dignity. Initially, you may find it difficult to acquire these skills, but don't worry because it is quite doable. I, as an international medical graduate, could do it successfully in my first attempt. So there is no reason that you cannot do it. For you, passing PACES would be much easier than for me, because in my PACES course, I am going to tell you exactly what I did to pass it. You can see the link to my PACES course on the screen. If you are watching this video on YouTube, then please check the description box. Total score in MRCP PACES examination is 172. The breakdown of this score is as follows. For respiratory station 20, abdominal 20, history 20, cardiovascular 20, nervous system 20, communication skills or station 4 16, and for station 5 brief clinical consultation 1 28 and brief clinical consultation 2 28. A common mistake for almost all the PACES candidates is focusing only on the stations, but you don't have to pass or do good in all the stations. Instead, you have to pass all the skills. The examiners will give you scores for individual skills, and if you fail in any skill, that would mean that you would have to retake the entire PACES examination. Now you can see in the screen that the minimum score requirement for every skills to pass PACES. For physical examination skills, you must get 16 out of 24. For identifying physical signs, you need 14 out of 22. For clinical communication, you need at least 11 out of 15. For differential diagnosis, you need 17 out of 22. For clinical judgment, you need 19 out of 26. For managing patients' concerns, you need at least 10 out of 16. And for maintaining patient welfare, you need 28 out of 32. And you need at least 130 out of total 172 score in PACES. The mark sheet for MRCP PACES stations looks like this. This is the example of station 5 brief clinical consultation mark sheet. Here you can see all 7 skills are tested, which is written here, and the examiners can give you either satisfactory or borderline marks, or if your examination is very bad, then unsatisfactory score. The satisfactory score is equal to 4, borderline is equal to 2, and unsatisfactory is equal to 0. So here you have all 7 skills, and if you get all satisfactory, then you would get 7 times 4 equals 28 score. At the end of this video, I would like to summarize the PACES stations. For stations 1 and 3, you would have to do the following: demonstration of a comprehensive and correct physical examination technique, ability to detect clinical signs, ability to construct a differential diagnosis, ability to suggest sensible and appropriate treatment and investigation plans, ability to treat a patient with dignity and respect. For station 2 or history taking station, you would have to do the following: gather data from the patient, construct a differential diagnosis, deal with concerns the patient may have, construct a management plan that is explained to the patient clearly, and to treat the patient with dignity and respect. For the station 4 or clinical communication station, you would have to do the following: guide and organize the interview with the subject, who may be a patient, relative or surrogate such as a healthcare worker, explain clinical information, apply clinical knowledge including knowledge of ethics to the management of the case or situation, provide emotional support, treat the patient with dignity and respect. For the station 5 or brief clinical consultation station, you would have to do the following: you would have to take the brief clinical history and do the focused clinical examinations. You would have to find out the clinical findings and not find out the findings that are not present. You would have to take the important positive and negative history, and at the end of the history and clinical examination, which means at the end of 8 minutes, you would have to formulate a differential diagnosis and then defend these differential diagnoses and answer any questions that may come from the examiners.